kind of a windfall or something like that. But your health is entirely your responsibility. And when we talk about health, it is not just physical health. We're talking about mental, social. It's a kind of a holistic health we're talking about. So usually our focus on the physical part, how the appearance and as we are taught in medicine, health is considered the absence of disease. It's a disease-free state, right? So that is what health is about. But when you talk about fitness, fitness is a different ballgame. So fitness is something which allows our bodies to respond to any kind of challenge which is placed on it other than our routine life. So, and it has numerous aspects to it. As you can see in this slide, it's not just about strength or power or endurance for that matter. It's flexibility, it's agility, cardiovascular capacity. There's so many aspects of fitness which we need to work on. But the truth is, this is all nice to be said and heard. But the truth is, as a species, man has stopped moving. We live today in a world where we are surrounded by easy availability of energy dense foods. And there are such luxuries available to us that we don't really need to exert at all. So this is what our normal routine would look like. You wake up in the morning, you get to your workplace, you drive there, and that does not count as exercise. You come back home, you sit in front of the television, and you go back to sleep. So this is what most of us do, including the doctors. We do know, however, the benefits of exercise. Yes, we do. So there are numerous benefits. And if you sit and enumerate, yes, not only does it make you stronger, it improves your cardiac function, body weight goes down, bones, joints, immune system, and your mood. It improves your mood. Those who have exercised and those who do any form of exercise will identify with this point. You get that high after any exercise routine, right? So what are the goals? Earlier, it was just a question of to be slim, not get sick very easily, and you might have a beach body of some sort. But now the concepts are changing. It's more of strength, energy, that feeling of positivity, longevity, and being disease free. And yes, setting a good example for the next generation, right? And last but not the least, social media. If nothing else, just do it to fuel your ego. But it's not just about weight loss. Let's not confuse health and fitness with that. It's about the life you gain. And believe me, I will be talking about this as we progress. It is an amazing life you gain by taking care of yourself. So friends, this is in one slide, the reason why I am here, because Mahesh and Mahesh was talking about a decade ago. That is what I used to look like. That photograph has been taken when I was in Kokilaben. And over the last decade, it has been a long journey. So I would like to share that experience with you guys. So let's talk about the hot topic. So fitness is all fine and health is fine, but most of us want to get on this bandwagon for fat loss. You want to lose weight, right? So obesity, as we all know, medical term, is just excess body fat in your body. So it's now a global pandemic. Sorry for that word. It's not a pandemic, it's an epidemic. This COVID times does this to you sometimes, Okay, but there was a time when India was not that badly affected. It was not. So gradually now we are seeing that 73%, and Mahesh, these are really scary figures, you see. 73% of urban Indians are overweight. It's maybe a different ballgame in the villages and the lesser towns, but it's the lifestyles we are leading. 1 out of 2 Indians are obese, actually obese. And the shocking part is that the age for maximum risk is in your third decade, 28 to 38. And that is, if I've followed with my own batchmates from school, from college, and you see, it is this phase of their lives where you start losing your fitness and your health. And is it just obesity? No, my friends. There is an increased risk of developing diabetes almost 80 to 85%, which is a very, very significant amount. We'll talk about this direct relationship soon. And the scary thing is that 30% of children now are suffering from obesity. So that is something which is worrying. It's not due to stress, it's not due to your lifestyle, it is happening to children. So if we are cognizant of the problem and we are informed as parents, we can take care of our next generation of Indians. Numerous factors have been attributed to this epidemic and rise in the numbers of obesity problem. But in my opinion, the two factors which are, I think, in our hands and totally controllable, one is our dietary habits, and the second is our physical activity. These are two things which we will focus on today. And as doctors, we know, I don't know, it is sometimes we just are in a state of denial as to know that obesity is just about fat loss, but there are lots of medical issues, and I'm sure our colleagues who are watching this have seen these in various specialties. Lots of systemic problems arising out of obesity. And the shocking part is there are also certain types of cancers which are more common in people who are obese. So this is something which is really worrying. And that, I think, Mahesh, is what really at some point got me going from my state with what I was in 2005.
Yeah, that's a very impressive transformation that you've spoken about. In fact, as people who see pain in orthopedic conditions as well, a lot of non-communicable diseases that our elderly patients come in with, and even the younger generation that comes in with, a lot of their symptoms are directly related to their body weight, their metabolic
True.
condition, and that's a huge segment of patients we see nowadays. Of course, this year has been different because we saw communicable disease kind of taking sharing that center stage thing. But traditionally, I think it's always been non-communicable diseases in the last two couple of decades or so.
That is true. And I believe, like say in your specialty, when it comes to pain management, there is a large amount of psychosomatic overlay, I believe, which really affects. So I can tell you by my personal experience, when I was in this state, as you can see, 2005, you are kind of harboring this kind of negativity inside you, which sometimes comes out. It manifests as various disorder, it as various symptoms, I would say, not disorders, but it can also amplify
Hmm.
your symptoms in all
Yeah.
these multi-system things. So that
Yeah,
is
I guess
something which will
how you deal with it also might be different
exactly,
because you're
exactly,
already going with
exactly.
this burden around. Yeah, makes sense.
That's right. That's right. That's right. So I think I will just go ahead with what my story was. So today, friends, I would like to just cover a few of the points which I've written down here. One is to give you all some kind of awareness on fitness, to try and motivate you all with my story, and to make you all realize that fitness, you have to follow the science. It's not that what worked for me or what works for it's there's a logic behind it which I hope to convince you guys. And last but not the least, most of us who were considering ourselves quite fit, and once the lockdown came in, things just went out of control. So we'll be talking a little, highlighting about what my approach was during the lockdown. So as far as my story starts, it all began. This is in school. This is my last day of school in the 10th standard. So I was one of those grumpy kids, and I was always obese. And I was told it's genetics. My parent, my whole family was on the bigger side. My metabolism is slow, so even if I eat a little bit, I will gain weight. But being healthy is important. Don't go by your looks. You have to be healthy. But for me, I just wanted to look normal. I didn't want to be thin, but I didn't want to be fat. That was my goal. So coming to genetics. So when you talk about genetics, it's very interesting, Mahesh. So there is a certain amount of genetic makeup which can decide your body structure. And this was way back in 1940, the soma types as they're called, and they were later modified. So you have the endomorphs, mesomorphs, and the ectomorphs, as you can see in this, but I'll just make it a little more clearer for our viewers. So the ectomorphs, and you can look around you and you can picturize your friends, your colleagues, and your relatives. Ectomorphs are the tall, lanky, thin guys. If you draw a shape around them, they look like a vertical rectangle, right? Very narrow shoulders, narrow pelvis, and tall, lanky, lean, long arms. You have the mesomorphs in the middle there who have a basic muscular structure. So they have a little shoulder structure, have a little V body shape, and they can be both ways, but they're inherently muscular. And you have the endomorphs. Endomorphs, that's where I fit in. So the endomorphs are short, stocky, and if you draw a shape around their trunk, it looks like a square. So they're just short, stockily built. There's a lot of strength involved, but they fatten up very fast. And of course, some some places the classification fails. So we will not get there. Another factor in genetics, yes, is the gender difference of fat distribution. So in males, the android fat distribution is usually on the belly, that's around the waist. And in women, or the gynecoid kind of distribution is more around the hips and the thighs. Again, it's something which we see very commonly, but we don't really pick this up, right? So this is where the genetic part of obesity ends. This is it. This is genetics. There's nothing more to it. So this is me. This is how the endomorph Dr. Ashish Jain was. And for all our medicos who have joined in, this was in MBBS with my friends. So that was my student days, and I was focusing on studies and passing the MBBS exams and eat well, study hard, sleep on time. That was the schedule. No concept of fitness or diet or anything or exercise. You want to become a good doctor. Joined MS Orthopedics. Now this is our residency party. Again, Dr. Jain has become a little wider and the endomorph is oozing out everywhere. But again, we are studying, we have to pass, we have to become a great orthopedic surgeon. And you're not judged. See, when you're in medicine, you are amongst your patients and your friends, and you're doing this kind of selfless work with the public. And so you're not really kind of taking care of yourselves. And then one becomes a consultant. And this is, I think, Mahesh, you remember this famous apron of mine. This is what I used to be wearing. So this is my Kokilaben apron, and this is what I was 10 years back. So everything was going fine, successful, well-known orthopedic surgeon, but obviously not taking care of myself. So as a summary of my story, this is what I would give a message to you guys. You have to take care of yourself. And it is not, again, I'm repeating to you, it is not about weight loss. Fitness has many aspects, and I will try to give that point to you guys. But people call it a body transformation, but literally you are reborn, as you can possibly see in this picture of mine.
It was an amazing transformation. In fact, I was going through the body types and I realized that I'm a very selective endomorph. There are places where I'm endomorphic. so
So there is actually, that's a good point you brought up, that there are overlaps. So people can be endomeso, you can be meso-ecto. So they can be predominantly mesomorph, but they have certain endomorph characteristics. But these are the three large categories, but there's quite a lot of overlap, quite a lot. But this is how it is, Mahesh, in the medical circles. When you are focused on your career and on your patient care, this is so at some point you tend to lose track unless you really get that wake up call. So
how now you've mentioned this transformation that you've had. So how has that actually impacted your? So you've told how you felt about yourself, and of course many of us have told you how we have felt about ourselves. That we've always felt कि हमारे अंदर भी ऐसा एक है. There is this bodybuilder inside all of us. So how do you feel it has affected you in a professional context? If you can,
see,
how has it
I think it
impacted you?
is. Yes, yes. So I think other than because see, if I recollect well, when I was a student and a resident, I used to get tired, I used to get breathless, I used to have fatigue, and this was all. And now I realize in hindsight, it's all to do with my nutrition at that stage, and obviously the lack of any kind of exercise, what do you call it, endurance. Now what I've realized is that now not only has this fitness journey given me a certain kind of a discipline in my life, it has also improved. And being an orthopedic surgeon, yes, there's a certain amount of strength required for trauma surgery. So this helps me there as well. And I feel the biggest thing for me is patients expect a certain amount of positivity and confidence from the treating physician. And unless I believe, if I'm not happy inside and I don't have that kind of self kind of confidence, it will not ooze out onto my patients or to my friends or my circles, you see. So that is something which I am finding now, which is going a long way in helping me, not only in my personal life, but also in my practice. So I think we move ahead. So what, coming back to the point which Mahesh just said, so uh, usually as medical practitioners, we are so focused on our selfless journey. So as during residency, like now, I'm sure during the COVID times, there are people who are on the front line, the COVID warriors, and the people manning these wards, and the people at the various centers. So there's selflessness, but I believe that, like this slide shows, all of us have traveled by airlines, right? And that one announcement which comes at the beginning of safety precautions, nobody really pays attention to it. But one of the important things they say is put your oxygen mask first before assisting the one on the seat next to you or your child or anybody else. So that is the important message I would like to give, that take care of yourself first. If as a healthcare provider, you are not taking care of yourself, I don't think you are doing justice to your patients. So this is something which is very important, and I think we all should, as medical and healthcare practitioners, take this message home and take care of ourselves. And like Mahesh asked me, it is these long hours of work and the traveling. Sometimes you're going for meetings. You have your conferences, courses going on, and this can be in any field, not just medicine. So your endurance improves, your strength for physical jobs. So surgery, procedures. Like I'm sure Mahesh, you also wear these lead aprons at your during your interventional procedures. It's just, it does tax your body, and when you're young and you are in that zone, you may not feel it. A few years down the line, it starts giving you those aches and pains. Even at home, being a parent, there are certain things which are expected from you. Lift this, move that, do some stuff in the house. So that fitness helps. And last but not the least, like I said, body image in your own eyes and in the eyes of your patients, where what is called as a persona, I think that matters immensely. And that has really changed in my case. And I would believe, now there's a very famous saying which I recently read. It says that even if you are not born in a healthy family, make sure a healthy family is born from you. Okay, so I think my goal today is to give my kids this fitness message and imbibe these principles in their lives, so they possibly don't make the same errors which I did. And that, I think, we owe it to our next generation. And now another thing which, now when Mahesh should ask me about perception of as a practicing this, if you see this, according to the people, there have been certain patients of mine who see me after years, and they miss that old chubby, plump Dr. Jain. So somewhere down the line, maybe in the public's mind, a lean, fit, muscular, dynamic looking surgeon is possibly inexperienced as against an experienced doctor. Maybe it's a reflection of your selflessness. But I think it's time we change this image for good. So I hope by the end of this masterclass, many of our friends and colleagues will take this drastic step and break this mold, in a way to speak.
So before we go there, I just drew up a brief poll which I'll launch now. So
Yes,
all the
yes.
participants, we do that once in between the class so that
Great.
people
That's
can,
excellent.
So we'll just put this poll up right now and try answering it, and we'll see. We'll just get a demographic of what's happening. We'll take a 1 minute or about say a one
Time
and a
out.
half minutes to timeout to answer this question in the poll. Now this poll won't be visible for those on Facebook Live. I've noticed that. So the questions are, how often do we work out? What is a barrier for workout? If you work out, what do we prefer? And where do we prefer workout? Like it's indoor, outdoors. And if we work out, do we have a trainer? There's some basic questions here. And we have the votings commenced, and people are beginning to put in their votes. So over the next half hour or so, as Dr. Ashish, you're talking about, your the next part of your talk. At
Yes.
least we have a background of the demographic that's listening to us right now in the meeting. So, you know,
I think so. I think it's time to stimulate that kind of introspection, and I think it works excellently to get a better perspective.
and I don't know about this, but this concept of a workout or a gymnasium. So, well, when I grew up, there was never this concept of a gymnasium. I've always thought that you just run around, play, and sport, and that's the only thing. Then I started seeing some of the older guys, of course, the older teenagers going to a gym to get all buff and work out and so on. And that's
Yes,
probably how it also it reflects how society is doing. And I think with 2020, there's been a lot of introspection when it comes to health. The world as a whole is looking at its own health right now.
true.
So we got about 10 seconds or another 20 seconds, and I'm going to stop the polling. So we have about more than half of our attendees who voted, and just check what it says. Another 20 seconds, and I'm going to close polling, please. All right, so I'm just ending the polling, and I'm going to share results so that you
Yeah.
can see this on your screen now. So we have most of us who work out less than 5 days a week. Some of us who don't work out. That's about 23%. Lack of time, of course, significant barrier, and uh, those who work out prefer yoga as a form of workout, and indoors, of course, in these times it's indoor that a lot of people prefer, and many do not have a trainer. So that's the kind of demographic we are looking at. We don't have trainers. Indoor workouts, preferably yoga, about 40% into weight training. Lack of time is an important problem, and less than 5 days a week is the verdict.
Right.
Please continue. Yeah.
Nice, nice. So I think that that gives us a good perspective, and I hope this helps in changing that poll data. Okay, so one sec. Something. Okay. So Mahesh, now let's digress. Let's get down to the science of fitness, right? So having seen a little introduction about obesity and about my journey, this is what we have. This is one of the truths we have been taught to believe, that obesity or fat gain is an imbalance between the calories or the intake and the output, that is a physical activity. This is that calorie balance they keep talking about. So this balance is essential. That's what is being told. So if you eat too much, you gain weight. If you eat less and you move more, you will lose weight. But if you want to maintain it, it has to be a fine balance, which in my opinion is very difficult, if not impossible. So I'm sure everyone listening to me today will believe in this model. And this is what I used to believe in, that our body is like this one receptacle. Everything we ingest in calories goes into this receptacle, and whatever we utilize goes out. The rest of it is stored as fat, right? And fat is the storage form of energy in our bodies, as we all know. And so what is the solution? So the solution is, okay, let's cut down the intake. And maybe a lot of you would identify with this story chart which I've made, and this is exactly what I used to do earlier. I used to starve myself. I used to go on these crash diets and I used to do lots of exercises. So, as Mahesh, you were mentioning about running, I never used to go to the gym once upon a time. I used to go to the race course. However fat I was, I used to put on my Walkman and I used to be just early morning running there during my internship. And yes, what happens is you do lose weight, but you start losing muscle as well. All right. And your body, our bodies are very efficient machines. The body comes to know that calories are not coming in. So what does it do? It starts slowing the metabolism down. So at some point, you'll find that you are having less calories, you're moving a lot, but the scale gets stuck. It reaches a plateau. So what's the next thing to do? You recheck your schedule and your plan. I want to eat lesser. Maybe I'll do more cardio. The muscle loss accelerates. And the end result is that you are weak, you are always hungry, and you are frustrated. And the results stop. And what do? You just go, you sort of blank out, you stop the diet, you get frustrated with it, you want to eat, and you stop the exercises, and the weight just comes back more than it was earlier. So this is a very common story, and this I have been through this. And if you are going through this, please change after listening to today's talk. So one has to differentiate between weight loss and fat loss. So even today, when someone asks me, I want to lose weight, they actually mean fat. Nobody people want to lose the fat, right? And what's the difference? When you lose fat, you are improving your fitness, you're getting stronger, your endurance is better, you are delaying the aging process, and you are reducing your risk of diseases, as against weight loss, where everything is the opposite. So you must know what you want. Okay. So that was the earlier theory: calories in, calories out. Now, this is the new theory which has been proposed, the hormonal theory of obesity. So, what is it? The hypothesis is that there is a hormonal imbalance in the body, which causes obesity, which in turn makes you eat too much and doesn't allow you to exercise. So, you do not get fat because you overeat, you overeat because you got fat, right? So, this just turns the cart all around. So this is the new concept we will try and logisticate. Okay, so this is a very important slide. So as compared to the earlier single compartment theory, where it was one receptacle and all the calories going in, now it has been shown that you ingest your calories, it gets divided into two channels. The first channel is your glycogen stores. Now these glycogen stores are in the liver and in your muscles. They store glycogen, which is basically clumps of glucose molecules, which are easily available at the site of requirement, which is your muscles, for physical activity. So, what do you do with the extra calories you have eaten? Now, the body will not let those go. It's like having your wallet and the bank account, right? So, similarly, our bodies have the fridge, and you have this freezer, which in the houses abroad you can say is in your basement somewhere, not very accessible. That is, my friends, is your body fat. So on a daily basis, you don't go to the freezer, you just use your fridge for whatever you need. When the fridge is over, only then you will go to the freezer, right? And what regulates this? Who decides what goes where? It's insulin. Insulin will decide this entire traffic, right? So just to recapitulate, you eat the carbohydrates, and now we are focusing on the carbohydrate because most of our diets, and it's been shown that carbohydrates are the culprit in obesity, right? Not fats like we were told earlier. So carbohydrates are ingested, it got broken down to glucose. Glucose is primarily used as the only fuel source for the brain. It does not require insulin, goes straight there. The rest of it goes to the pancreas, it secretes insulin, and the insulin has three functions. It is the most anabolic hormone we have. It stores glycogen in the liver, small amounts, usually it's about 70 grams. The rest of it goes to the muscles, about three times that, about 200, 210 grams of glycogen there. And the remaining part is all taken by insulin and put into the adipocytes. And this becomes your stored energy or your freezer. So this is what it does. Insulin attaches to the cell, opens up the gateways, glucose can enter the cell, and that's how the body utilizes glucose. That's the role of insulin. So what's going wrong here? So when you have sugary foods or refined carbohydrates, as we say, the glucose intake goes up, the insulin is secreting at massive levels. It's causing a lot of fat deposition, as we showed. But since the insulin goes up, the sugar drops dramatically, and you get very hungry and tired. So you're ready for your next sugar meal. And this vicious cycle is what starts the problem. And a point comes where your body stops responding to that insulin level. The insulin level is rising, the glucose levels are rising, and you start developing, in medical terms, what is known as insulin resistance. Now, this is the problem. Not only are you getting obese, but you are now heading towards a diabetic situation. And this is that vicious cycle. You're eating food, insulin goes up, your cells are not responding to insulin, you're getting resistant, and the fat is getting deposited, and you're just tired. So, friends, that is what this new theory is about. High insulin levels. What are the hormones? Insulin, and they've also shown cortisol to a certain extent, which is the stress hormone. You get obese, you start eating more as a result of that, and you're just not able to exercise because you're tired and fatigued. You have your sugar levels are so fluctuating, you just have no energy, you don't have the drive to exercise. So that is the accepted reason for obesity now. And once it goes to the next level, your system is flooded with glucose, which is lying in surplus. The insulin is not there to, the insulin levels are going high, the receptors are not responding to that insulin, and you are headed to type 2 diabetes. And that is what we were talking about in the early slides, how it's not just a question of the obesity, it is now going into diabetes. And we all know the complications of diabetes on all our body systems. So now, Mahesh, the question is, how do we get out of this conundrum? How do we make sure that we are using that stored energy and not the calories? So this breaks that whole concept of calories in, calories out, energy in, energy out. So now we have to rethink this whole model.
No, I think 2020 has been a very crazy year. I've seen a lot of crazy things happening this year, but nothing beats the fact that I'm actually listening to an orthopedic surgeon talking about biochemistry. I never thought in my faintest
Oh
dreams
God.
an orthopedic surgeon would talk biochemistry. Please go
and, and
on.
I'm
Please go on.
and I'm and I'm and I'm swab negative, by the way, so it's okay. So it's me talking. So I'm quite amazed myself, but I think you put it very well. So just appreciate the knowledge you're getting. Okay, so now friends, after all this gyan, now the question is what is the most logical way of targeting the stored food? You want to utilize that, and that is something which I used to be questioning all the time. People used to say, Ki, have small multiple meals, metabolism, this, that. I said, but when will that stored fat get utilized? So the only answer to that is when the insulin switches off. And that will only happen when you are in the fasted state. So when you're in the fasted state, the fridge is empty, you're finished off everything. Now the insulin is not in play. The insulin levels drop because nothing is coming in. You're fasting. The glycogen stores are depleted with your activities during the fasting phase, and now you will only have the stored fat as energy to utilize. Make sense? So that brings us to the next interesting part of today's chat, and that is intermittent fasting, which is the hot topic, I believe, everywhere. And I was introduced to this just during this lockdown as a necessity, and I did a lot of research on this, and I realized that this is one of the ways to break this whole obesity and this carbohydrate vicious cycle, right? So what is intermittent fasting? I'm sure most of you know about this. So you have in 24 hours of the day, you decide 16 hours of fasting and 8 hours as a feeding window. So you have a fasted window and an eating window, as they call it, or a feasting. So how is it different? Okay. So logic would say, so fine. If you're telling me I'm going to have 2000 calories a day, which my dietitian had told me earlier, and I was following that diet, and I was having 3-4 meals a day of 2000 calories, You're telling me now that I should eat only those 2000 calories in 8 hours. How is it different? What are we changing here? So this, my friends, is the crux of the matter. So what happens when you restrict calories? So you restrict into 2000 calories a day. So your what is known as calorie restricted means against time restricted. So intermittent fasting is time restricted. This is calories restricted. You are never, you're always hungry. There is no satiety. The insulin spikes keep happening at frequent intervals. So that insulin really doesn't switch off. So your stores, that is the fat stores, are locked down. As long as insulin levels are high, those fat stores cannot be mobilized. The policeman is not allowing that fat store to be used, right? Your metabolism is slowing down because you're not eating, there's no fat loss, and you are tired. As against that, when you're doing intermittent fasting, which is time restricted, you eat till you're full, you have no hunger, the insulin is controlled during the fasting time, and the fat stores are mobilized, so there's fat loss. Your metabolism is boosted because when you are in the fasted state, you might have heard about all this ketosis and the ketone bodies, and you're alert because there's no fluctuation in the blood sugar, and you're very energetic. Much against what many people think, you are not slowing down. So this is a very important slide which will summarize the difference between intermittent fasting versus calorie restricted diets, which most of us tend to follow. So what is allowed? In those 8 hours, you can eat technically what you want, but if you do smart food choices, you will reach your goal faster. And during the fasting phase, you are allowed green tea, black coffee without milk or cream. Cream sometimes is allowed, no sugar, obviously. Plain water as much as you want. Apple cider vinegar in small quantities can be taken, which I take sometimes, and some fiber supplements like your isabgol can be had. Otherwise, no other foods, no artificial sweeteners, no soft drinks, nothing, 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 right? And it's flexible. You can decide your feeding window as you want. So you can either skip your breakfast or your lunch or your dinner, and you just decide which 8 hours of the day, depending on your schedule and what time of the day you work, you can decide for yourself. So it's cheap, it's flexible, and it's effective. That's the most important part, and it has numerous benefits, numerous, way beyond the benefits of fat loss. It improves your, and if the next level of intermittent fasting is what is known as autophagy. Maybe some of you have heard about it. Is that Nobel Prize winning theory by the Japanese scientists in, I think, 2016. So where it was described that during the fasting phase, the body digests its own uh, damaged proteins and organelles and heals itself. So it has anti-cancer, anti-degenerative, oxidative stress, so numerous benefits. So Mahesh, this is the current uh, hot diet, in a way to speak, which people talk about. But I don't look at it as a diet. You do something which becomes the way you eat. It is a way of life. So I would say that is what I look at it as. So just to summarize, this diet part is key, is 70%, but there is also the workouts, which will just amplify the benefits of your plan.
So that's a very interesting point. Apart from the fact that you are a Jain and talking to us about fasting, there's a huge conflict of interest there. Uh, and it also, I mean, there's a disclaimer that I'm sure that you're not a certified nutritionist, but a lot of what you're saying comes
No,
from intense, reading and studying about this topic. And as a science, I think nutrition stands somewhere where you have many opinions, many thought
true.
processes. But we've heard this very commonly that it's 70% diet and 30% workout. Now, I've also heard that if you, there are those who say that it doesn't matter what you eat as long as you burn it out. If all you need to do is just work out hard.
True.
How true is that? Is that something you'd advise, that
No,
eat anything but work out?
yes. So I think, Mahesh, that's a very important point you brought up. So what happens is that at some point, and looking at certain people's examples, possibly who are insulin sensitive, you come up with this theory that as long as you are active, you will burn those calories. But let's put it to test. Okay. So it is let's this is beyond doubt that diet is king. Okay, there's nothing to argue on that. And the bottom line is, irrespective of the hormonal theory, irrespective of that, caloric overconsumption. So it's that excess of carbohydrate we're talking about in the first place. So caloric overconsumption is the basic cause of obesity. There may be certain medical reasons for you becoming obese, but the commonest cause is caloric overconsumption. And that concept of it doesn't matter how much you eat as long as you burn it off does not hold true. There is no genetics involved in this, and lack of exercise doesn't make you fat, like I showed you. But the thing I would like to say is the reason for these kind of statements coming up is we tend to overestimate the power of exercise, and that is the problem. We tend to. So let's see whether that holds true. For example, now you are in the OPD, you are in the operation theater, you finish your surgery and you come out, and the only snack available to you is this nice plate of samosas waiting for you, right? So again, can I ask you, Mahesh, what do you think is the calorie value of this samosa?
It's about 200 or so.
Near, you're close, you're close. Yeah, so two, maybe one was 200. The two of them are 350 calories. Okay, one plate. I don't deal in single samosas. Okay, so but to burn that, by the question you asked me, you will have to run for 2.5 kilometers nonstop to technically burn this two samosas only, right? Okay, something easier. Come on, chips. Now we generally have chips. You're sitting watching telly, or you're just at some restaurant, and along with your mains, you get a plate of chips, and you just keep munching on them. So similarly, so when you talk about chips, again, 50 grams is about 268 calories. It's just oil, salt, and carbohydrate, right? You will have to walk briskly for an hour and a half to 2 hours to technically burn this off, right? So it's not something which is doable, or that's not the way things work. And if you talk about the various diets, we spoke of intermittent fasting, but most diets, whether it's a ketogenic, whether it's a Weight Watchers, a paleo diet, whatever it is, at some point you are expected, or to get the benefit of that diet, there has to be a caloric deficit. It has to be there. So I think that is one of the benchmarks, even for intermittent fasting, although it is marketed in a way that you can eat what you want, but not when you want. But I believe they presume that you will have some limitation for that meal, right? So, but you may be superhuman in those ways, but calorie deficit is the way to go. So, coming back to the thing, it is diet has to be is the main thing to be followed. Do not try to overestimate the power of exercise, and do not cheat on your diet and try to compensate it by exercise.
So,
Definitely not.
so the only way I think it makes sense is if I have to eat samosas, maybe I'll have to come to the canteen in your hospital about 20 kilometers away,
Yes, running.
running, and then have those. Right?
Yes. So I think, Mahesh, we should move on to the my where I come in now. As an orthopedic surgeon, I'm more passionate about my exercises rather than the diet. So let's get on to that. So what is exercise? Now, as an orthopedic surgeon, it kind of I've seen both sides of the story. So I see people coming with problems of exercise. So makes me question what is the exercise, how much is to be done. Okay. So when if you want to classify or define the word exercise, it has to be purposefully directed physical activity. It has to be above a certain resting threshold for our bodies. So what does it mean by this? The human body, like all species on this planet, have a certain amount of physical activity which is encoded in your genome or your DNA. So a cheetah is supposed to run after its prey. So a fish is supposed to swim. So you as a human being are supposed to walk. And yes, some people believe our bodies are meant to even run and jog as hunters gatherers. But that is considered a part of our normal activity. That's what we're built for. So exercise has to be above that. And why above that? So that it stimulates some adaptations in your body, which are not only mechanical for strength, but also triggers a lot of metabolic processes which keep you fit. So that brings us to the next point. So okay, so we are going to exercise, but how much? What is the minimum? So as a busy, now we saw our poll and our survey, people don't have time. So what is the minimum exercise I can do? for the maximum benefit. So like in medicine, like when you are prescribing a drug, what is the volume of exercise? That's the dose. What is the intensity or the strength? How frequently should I do it? How long should I take the medicine? What is the basic exercise required to get the maximum benefits with the least wear and tear to our bodies? So that's again a part of it where being an orthopedic surgeon, I've seen the negative parts. So friends, the take home message for you is yes, the best exercise for you is the one you enjoy. Simple. It fits your time's constraints based on which part of your career you are in. All right, whether you're a morning person or an evening person, when can you exercise? It is suitable for your age. So don't try watching someone else do stuff. There's a lot of information overload nowadays. Do what is suitable for you and your body structure. The purpose is not burning calories. It's about making you stronger, fitter, healthier. Do something you can sustain. Consistency is the key. And it should just be the optimal stimulus with minimum strain. So that is the guidelines for choosing the kind of exercise you want. And the rest depends on your goals. What are your goals? If you're on the slimmer and thinner side, you want to gain muscle mass, is different. You want to get lean, excellent. You want to build strength, you want to go into powerlifting or something. And last but not the least, athletic performance, some for agility. Nowadays lots of people are talking about marathons and these kind of functional things, games, sports. You're into some kind of sports. So as an orthopedic surgeon, I have seen a lot of people now the lockdown has ended. People have rushed back to the gyms for workouts, and a lot of them are coming back with problems. And the commonest reason for that is you are not, or you've forgotten the basic principles of exercise. Number one and the foremost is you have to plan your exercises. You have to fuel your workouts. So eat according to your exercise plan. Training gears, especially the shoes, the kind of supports you wear for heavy lifts, the kind of clothes you wear for your runs and for the gym will have an impact on your efficiency. Warm up is essential. First is the general body warm up, which will just get your heart rate going up, or you break into a little sweat, your body warms up. And the second warm up, which is very important, is for the body part you're going to do. So, for example, if you're doing chest on a particular day, like what I'm talking about, gym training, you go do a set of push-ups. If you're going to do back, you do pull-ups. If you're going to do legs, you do free squats, or you cycle, something like that, a local body warm-up. And then go slow and steady. It's called progressive resistance. Don't just rush into things. Don't go and lift the heaviest weights. And never overtrain, because the time you start, the more time you spend in the gym trying to get those muscles going, you are stressing your body. Exercise is a stress. Like I said, you have to find that right balance between benefit and risk, right? So don't overtrain. 45 minutes to an hour, cool down well, do your stretches, and you must have rest days. You must have 1 or 2 days a week is to do nothing. All right, the body has to recover. And why is that so? Exercise just stimulates the muscles and your fitness. You don't need to annihilate your body or your muscles during that 1 hour workout. That is detrimental to your health. Right? So, to summarize that, make exercise a celebration of what you are capable of. So, when I go to the gym, my aim is how today I will enjoy my upper body workout. Let's lift some heavy weights. Let's do it properly. Let's do some form. Last time I lifted so much. Let me try and lift 1, 2 more repetitions. Let's push myself to some new heights. It's not a punishment for that extra food I had last night or the party I'm going to after the gym in the evening. That is not the way to work out, my friends. It is not that is prone to injuries, and that is very short term. So when we come to the importance of exercise, now I'm going to give you a little details on which type of exercise has benefits. So before we go any further, this is one of my favorite slides, and this was very informative for me when I started my journey to look up nutrition and exercise. So this is a chart which shows how our bodies utilize the energy or calories ingested in a day, what is known as daily energy expenditure, right? And as you can see on this graph, 60%, that's the area which is circled in green, comes under the group of resting metabolic rate, or what is known as basal metabolic rate. The upper green band is exercise, which is 10%. The blue band below that is called NEAT. That means non-exercise activity thermogenesis. So that is what you burn with activities other than the purposeful exercise, like walking, driving your car, climbing stairs, maybe cleaning the house, whatever it is, right? And that little band in the center, orange, is thermic effect of foods. Your body burns calories digesting the food itself. So that is another important portion, but not so big. So coming to the crux of the matter, 60% is your resting metabolic rate, which is decided by your muscle mass. So the idea of a fat loss plan is to preserve muscles, which are going to be burning your calories even when you're doing nothing. That's what is called as resting metabolic rate, right? And the fat will automatically burn. So this is the chart against the other chart which I showed you in the beginning of calorie restriction and cardio. Here you see you're doing a good resistance training, you're stimulating the muscles. The muscles actually undergo some kind of strain, which is just, sometimes there's actual tears in the muscle structure. The muscle tries to repair. As it repairs, the muscle fibers hypertrophy, that is they become thicker, and the number of muscle fibers increases to get your strength going. And these two mechanisms will increase your muscle mass and your metabolic rate. And that, friends, will finally burn your fat. So it's a long process. There are no shortcuts here. And the bottom line is, if you compare weight to weight, 1 kg of fat will only burn 10 kilocalories a day, barely. It's not a metabolically active tissue. Whereas 1 kg of muscle burns about 100 kilocalories a day doing nothing. So the more muscle mass you have, the more calories you're burning, even at rest. It just makes more sense, doesn't it? So is cardio bad? No, friends, cardio is important. What is cardio? Anything that raises your heart rate is cardio. The heart also is a muscle. Let's not forget that. It needs exercise. So the benefits of cardio, it just keeps the tone of your cardiovascular system, which is the kind of a supply system for your muscles and your brain and your entire body. Better oxygen and nutrients going there, and the after products being washed away. But the cardio has to be done in moderation based on your age. So there's a formula to calculate your heart rate. Don't again stress yourself, don't overtrain. So 30 to 45 minutes to minimize wear and tear, get the maximum benefit thrice a week. And I generally prefer doing this cardio post strength training. The logic of that being that during your strength training, you've depleted your glycogen stores, that the fridge is empty. Now you will start utilizing your fat stores for the cardio. And the other benefits are the weight training, like I showed you, the muscle mass goes up and the calorie burn is for the next day or even 2 days later. So it's a long-term effect. And last but not the least is, like they say, use it or lose it. This is the CT scan through the thigh of a 20-year-old and a 70-year-old. The muscle mass is not just about how you look. As we age beyond the age of 50, we are all going to undergo a condition like you have osteoporosis for the bones, you get sarcopenia for the muscles. And this is totally preventable, friends, by a proper exercise plan, and it is reversible to prevent weakness, imbalance, and altered gait. And as an orthopedic surgeon, I have seen most people fall and fracture their weak bones as a result of the sarcopenia. You just lose muscle tissue. So if you want to know what is the best way, you join the gym. What is the best way to start? For beginners, I would say hit the machines first. They're the safest, and they will build muscle, and they're good for isolating various muscle groups. Go to a gym which has good equipment rather than jumping to the barbells and the dumbbells. But the secret is to train hard. And there's a famous saying in the gyms which says, train insane or remain the same. And that's exactly what I did. And that has got me to where I am today. So when you're in the gym, you should not even look like you're a doctor or doing any kind of medical profession, but that's how it is. And it's all about the intensity. So it's about what you do in that 1 hour of your workout. It's not the time you spend in the gym. It's what you do in that time spent there. The intensity is important. Like you see here, I'm using these machines to isolate those muscle groups. And a question was asked to you guys about personal trainers. Yes, I do believe in personal trainers. Personal trainers help you orient yourselves, get a hang of the machines. And nowadays, most gyms have a lot of equipment which can confuse you at times. They guide you and they give you a schedule. So I'm a believer in personal trainers even today at the stage of fitness which I'm supposed to be at. This is my current fitness trainer, and he's now, so we are kind of competing with each other now, and that is what I would recommend to you guys, that have a personal trainer at least in the initial phases to get you on your track. Mahesh, so I think we are kind of spoken about strength training. Oh, where are you off to?
Quite motivated by your talk, so I just
Oh,
thought
you
I'll
just had.
I'll, I'll dress for the occasion.
Oh.
I cycled about 2
So what did you
kilometers.
digest? What did you digest in the meantime?
I had a samosa at 7 o'clock.
Oh, great.
Yeah. So it's a fantastic. You've taken us through a lot of things, including the diet and role of exercise.
Thanks.
Uh, in fact, we have a few questions also now coming up
Great,
in
great.
the
I think
first part.
should we
So
get to them?
we could take those questions because they're pertinent to the first part. So we'll encourage all the participants to ask.
I
And
think so.
so one of the questions that's been asked by Dr. Rupal Dalal. Rupal's a great friend of mine. She does a lot of intermittent fasting, and she's very scientific and thorough about nutrition.
Awesome.
And she's asked this question about protein intake, and she mentioned that in India, a lot of us do not eat enough protein,
Yes,
and good fats, are important as a source of calories. And we
true.
have a very carbohydrate heavy diet. Anything you want to add to,
See, that is true. I think that's a very valid point, and I think let me just get a little pertinent slides for that. So as Rupal has mentioned, the three macros have to be balanced. So protein, the word protein itself means of prime importance, right? That's the origin of the word protein. So protein is number one. It's the building blocks of the body, and protein is not just for muscles. It's for all. So you have structural proteins, you have transport proteins like hemoglobin, you have hormones like insulin, you have a lot of proteins in the body. Your enzymes, your cell membranes, everything is protein. Carbohydrates are the fuel. So yes, they're important, but which type of carbohydrate choose makes a difference. And fats, yes, as Rupal has mentioned, there are good fats and there are bad fats. So just to quickly run through that, uh, when it comes to the proteins, my take on protein is that each meal should have 30 grams of protein as a threshold. Leucine is the key amino acid in the protein intake that's been identified for muscle protein synthesis. So the adults, as we grow older, the protein requirement sometimes goes higher because the hormonal control of muscle mass is lost. So we are going down on growth hormone, we're going down on our, even in males, testosterone and other things. You need more protein to stimulate that along with exercise. And I believe even if you're doing intermittent fasting, your first meal of the day, what is known as break fast. So when you break your fast, the protein content has to be really good. And the fats, yes, fats are important. They should make 20% of your diet. They are the energy store, they insulate, they're great for vitamins, they're protection for your organs. But the good fats like coconut oil, olive oil, nuts, avocado, fish, salmon, and tuna, these are the good fats I would recommend. So that's a great point brought up on nutrition.
Yes, and even on Facebook, we had a question by Dr. Shivani Agarwal on the role of intermittent fasting in women with polycystic ovarian syndrome, because a lot of young women who come to, of course, we do see a number of patients with chronic pain states, muscular pains, and PCOS,
True.
young girls. Is there any role? I mean, is there something that you have read up about, or we just
PCOS directly, I would not know, but yes, it does break. See, what is happening is eventually it is the final common pathway, I believe, to get that fat mobilized, whatever the hormones responsible for it, is so insulin plays a critical role, right? The remaining the hormonal balances, I think, are best understood by the gynecologists and the endocrinologists. But I have seen in even these kind of cases which are resistant kind of obesities. Diet control, especially intermittent fasting, does break the shackles on that fat stores and mobilizes it. So I think intermittent fasting is one of the best ways, especially in morbid obesity. And also, so I think other than the physiology, what it has taught me during this lockdown is disciplining. So Mahesh, for me, when I started intermittent fasting, it was not so much of the autophagy or the medical benefits. It was just like, okay, I'm at home, but I cannot eat till 12. I cannot eat till 12 in the afternoon. And then I will not eat after 8 in the night. I can do what I want. I can watch TV, I can do this, I can do my Zoom meetings, I can sit and mope about the coronavirus, but I cannot eat out of that window. So for me, just the discipline itself. So I tell my friends and I tell my colleagues that if nothing else, just start it for the discipline. The rest will just follow.
That's right. So the disclaimer is, of course, that we're not are discussing as trained nutritionists, and we are sharing a lot from
Yes,
our
yes,
experience
yes, yes,
because
yes.
there's only so much that I can take. As I said, an orthopedic surgeon discussing biochemistry, and now if you start discussing gynecology and polycystic,
I know that
I
is.
think I've had enough. I've seen
I will
enough in
not
this
go there.
lifetime.
I'm not.
Yes. So we have a couple of other questions by Dr. Barnali,
Right.
and she's complimented you on your talk, and she says if you can share your daily diet routine, if it's an intermittent fasting. So I think a lot of questions are going on to the diet issue. Dr.
Okay.
Sadashivan Iyer talks about diet in fibromyalgia and an ideal diet there. And again, Dr. Rupal comes in with whey proteins and is it recommended in vegetarians? So any of these that you wish to take
Okay.
up?
So I think let's I just hit on the whey protein one. So I think, see, whey protein, in my opinion, is essential for vegetarians. Essential. All right. Now you can quote me on this because on a vegetarian diet, most protein sources will give you a massive amount of carbohydrates, which will put your macro balance off. Right. So the only way to get the necessary protein intake, let's say you want to get 30 grams of protein with minimum carbs or calories, whey protein is a safe way to go. It is vegetarian, it's from milk. It's not vegan, but it's from milk. Nowadays, you get pea protein and you get plant protein, lots of varieties available. So it is rapidly absorbed. It's a complete protein similar to an egg. So that's supposed to be the biologically value of 100. It has high leucine, which I said is important for protein synthesis. And I would normally say take it as a separate meal. Don't combine it with food because the absorption is very rapid. So I normally would take it early morning when you wake up or break your fast, between meals as a snack, or definitely post workout. And friends, there is no kidney or liver damage unless you have an underlying pathology. So, and also there's not enough time today to discuss this, but the range, now people talk about how much protein is enough. The range of protein, which most of us have been taught, is zero point 0.8 grams per kg. But that is not the requirement. That's the minimum requirement. That's not the optimal. That is the recommended daily intake of zero point 0.8. Beyond lesser than that, you will go into a protein deficiency. The safe range of protein intake varies from zero point 0.8 at one end of the spectrum to 2.5 grams per kg. So Mahesh, I don't know whether you've heard about this, but I was shocked to see this range. And we're not talking about 2.5 grams per kg at all. Maybe that's for professional bodybuilders and all. So I would say 1.2 to 1.5 grams per kg is the benchmark we're looking at, even for your vegetarians. And that can only be achieved by whey protein. And then you can decide which type of whey protein is good for you to kind of, you have various types of whey proteins available nowadays, as in isolates and those kind of things. So, but I would strongly recommend whey protein. And I think one of the questions was, what is my schedule, right? What did I do for my
Yes.
diet, my
So
intermittent
your
fasting?
your daily diet routine, yes.
Yes. So this is a kind of a summary of my diet. So it's not details, but I do a 16-8, sometimes I do an 18-6. So 18 hours fasting, 6 hours feeding. So my normal window is 8 p.m. would be my last meal. So my next meal will be either 12 noon or I can sometimes push it to 2 o'clock. So it varies. So it just gives me discipline. I definitely avoid sugars even during the eating window. I will not have sugars. I will not have refined carbs like anything which is maida, bread, biscuits, pizza, those kind of things. Never drink your calories. I never drink my calories. So no juices, no soft drinks. Avoid alcohol as much as you can. My protein intake would be 1.5 grams per kg minimum. And I keep a schedule to keep myself busy and distracted. And my home exercise plan we'll talk about soon. But the important thing is that during the fasting window, I have my black coffee, I have my green tea, I have lots of water. And once a day, I will have my ESUP Gold, which is a fiber supplement, which is allowed even during the fasted window. So this is what I do. And during those 8 hours, normally it will be 3 meals spaced out. So you don't keep snacking in those 8 hours, right? You don't want multiple insulin spikes even in those 8 hours. So break your fast, 1 meal in the middle at maybe 3 hours, and one final meal at the just before 8 hours, and then you're done.
So there's another question that's come in. Before we go there, again, any window period after which you're to have your proteins after you work out? Is there any window period in which you can have this? And another question is,
Um,
any natural
yes, yes.
protein intake? For example, if I'm like, I don't want supplements, then what are the natural sources then?
For vegetarians,
I mean, for across the spectrum. I mean, you're talking about.
across so see, first we talk about the anabolic window. I think that's what they're talking about. It's known as the anabolic window. So the belief was that within 45 minutes to an hour of your workout, if you consume protein, it is supposed to help in muscle recovery and repair, and doesn't allow you to go into a catabolic state wherein your workout was so intense that you're digesting your already present muscle tissue as energy, right? That was the logic. There is a certain school of thought which believes in that, but most people have said that if you have the required amount of protein over the day, so if you're having 1.5 grams per kg or even 2 grams per kg for professional athletes over the day spaced out, so what is known as protein distribution over the day, it doesn't matter. The exercise does not play a role. It's the protein intake, which is the stimulus for muscle growth, right? So if you have had a protein prior to your exercise, you are in an anabolic window already. But if you take my personal opinion, I take a scoop of protein post workout for the simple reason that that's the time where my body is kind of depleted like a sponge. I need something which will be rapidly absorbed and fast. And it gives me that it's like a fixed meal with all the necessary nutrients without having the variability of what is made, what is cooked, how soon it will digest, how heavy it is, am I feeling bloated? Just one shake and you drink it. So I would say yes, I would take one protein shake immediately post workout, but it's not a hard and fast rule. And coming to the sources of protein, they are numerous, numerous. If you're non-vegetarian, the things to stick to would be chicken breast, because that is supposed to be lean meat. It's white meat, not red meat like the chicken leg. Fish of any sort. Then the other things like all other kinds of meats are available, like red meats and all those other options. Eggs, even vegetarians, you are very good. Eggs, now there's a controversy about the yellow, but most fitness and nutritionists would say have the whole egg, unless you're going into some massive number of eggs like 8 or 10 plus eggs, in which case you should maybe have two yellows or three yellows at a time and have the rest in whites. So it depends on your goals and your calorie intake. If you're trying to build muscle, is different. If you're trying to lose fat, is different. But eggs, chicken breast, and fish are the number one. In vegetarian, you have things like soy, you have legumes, you have sprouts, beans, you have broccoli, you have nuts have a lot of protein in it. Paneer, low fat paneer, these are options, but I would strongly add whey protein. Strongly.
So coming to on the other question about yeah, we have a suggestion that tofu or paneer is also a good source.
Yes, yes, yes.
So we have a question from Dr. Aparna who's watching this, and she wanted to ask if there are any non-gym exercises. So as you see with lockdown, what has
Yes.
happened is a lot of people have, gym memberships. Now we have had an official reason not to go to the gym.
True.
So what do you recommend in this case? What are the non-gym exercises you recommend?
Okay. Now you've entered my alley. Okay. So now so now I would like to thank you for that question. So yes, the lockdown happened, and I myself, who was the gym rat, there's no way I would miss a day at the gym. You've seen me how I was in Kokila Ben as well. There were days when I worked out in the Kokila Ben gym itself. So there are numerous options available. Okay, so I'm just going to run through a few what I have done during the lockdown. First thing to do is free hand exercises. God has given me the body weight. I'm going to use it. I have my mobile gym with me. I had a bigger gym in the past. I have a smaller gym right now. So body weight exercises. So you can use your body weight as you for certain kinds of movements. So this is like push-ups, free hand exercises again for abs and core. So this is what is known as Russian twists. You get anything, you can do it without this medicine ball as well. Then again, another type of body weight exercise which I did during the lockdown. These are squats. As you can see here, I've taken the help of those resistance tubings or resistance bands as they're called. These are available. This I just managed to pick up before the lockdown on the Amazon shopping. So use your whatever's available at home. These are the same tubes again. Without the gym exercises, you just have these tubes. You can keep a pair at home. They come as different resistance. You can use whichever one is suitable for you. It gives a uniform resistance. It is safer than free weights. Then I went a little bonkers. I started picking up furniture in the house. So these are my chair workouts for my arms and different other body parts, shoulders. I started using the furniture with due care. I started my bulky workouts when I realized the furniture was not that heavy. So these are filled buckets. You have to be very controlled so you don't spill it all over your living room. So this is for my squats, for my back workouts, for my arm workouts. A lot of stuff I did during the lockdown. So there was no stopping me. So like they said, they can keep you out of the gym, but they can't keep the gym out of you, right? So this is what I did. Come 8th of May, a slight unlockdown started. I procured my weights and I slowly started building up a small gym at home. And this is what my gym today looks like. I have my bench and I have these kind of things lying around. And now I do a little more, not very heavy workouts, but I do have my dumbbells now and I'm able to do some kind of resistance training at home. So when there's a will, there is a way, Mahesh. So I think it was very tough in the beginning. When lockdown happened, I was literally like a fish out of water. But slow and steadily, the provisions are made. And even at home, the idea is to be intense. Idea is to go heavy. And you, like I said, the stress on the body has to be supra physiological to get the benefits. It's not just enough to do. So yes, you can always mix up things like you can do your yoga, you can do calisthenics, you can do those kind of HIIT trainings. But I would say there are lots of options available. Too many.
And what about rest? What do you advise? Because that's something that I do very regularly, like 7 days a week. What do you
you
advise
for
about?
rest, you have to dress up in your gym gear and lie down
Lie down.
for a proper hour with your sipper bottle. Keep sipping water as you lie down, right? No, rest is important. The body has to recover. And as we are getting older, now I'm 52, I do realize that. So generally now my weight training is alternate day, even at home. I've still not joined the gyms because my gym where I used to work out is still shut. And I'm not really brave enough to join a new gym as yet. I'm waiting for this new year time to pass. Some second wave, third wave. I've lost count of the number of waves now. So I am going to take it easy. I'm going to keep doing my workouts at home and maybe at some point, but rest days, yes, very important. Very important.
Fine. Uh, so we've had a fairly interesting an hour. It's already been an hour and 15 minutes, and we've had a very
Yes.
interactive audience. We've had quite a few questions on Facebook as well, which you have fielded. I would just encourage all the other delegates to, write messages. Dr. Barnali Das wants to understand if yoga can be a substitute for cardio.
Yes, definitely. See, not for cardio, because see, yoga, see, I am not a yoga person. I've tried yoga once or twice and I sweated it out. So maybe it was just the stress of the yoga on my joints which made me sweat. But yoga, I believe, if done properly, where you're utilizing all those muscle groups in various asanas, is stressful for the body, but I would not use it as a cardio. It's quite a bit for flexibility and for sustained contraction. So cardio, still my views on cardio are a little different because I don't feel that you can really separate cardio from strength because the cardiovascular system will cater to your needs irrespective of what you're doing. The heart and the lungs do not decide. And like they say, life is anaerobic. whenever we are under stress or whenever we are not really in an aerobic mode. So yes, cardiovascular function has been pushed through, and people talk about running and cycling and these kind of things, HIIT training. But yoga is more for, yes, some kind of muscle toning, flexibility for sure, and plus all those systemic benefits you get, and obviously the mental piece of yoga. But
Yeah, I
not,
guess.
I would not use yoga,
Yeah,
not
I
as a
guess it's
cardio
also
sports.
the mind body attribute. That the discipline that's required, the amount of meditation.
True, true.
So I
It's
guess
a way
it's
of
more
life.
about
I don't
it.
think it's just exercise.
I guess so. Yeah. I think we have had a fabulous talk, and all those of us who've been listening, and all those viewers who've watched us on FB, and we've had quite a few interesting observations and likes. So now, what else do you have to tell us, Doc? Now with your, I think you've started an Instagram page, right? And you've already crossed.
Yes, yes.
I think I was your
I've
2,700 follower.
that is true, huh?
Yeah, yeah.
You're keeping a tab. So this is my Insta page. So this is also thanks to the lockdown actually. Mahesh, there was no such page, right?
Yeah.
This
So
page was started by me in May.
and if I can understand, so this 2,700, I know this because I think I did this a week ago. I mean,
Yes, yes,
about a
yes,
week
yes.
ago. That's not
True.
bad. So I think you're in that
Not
zone
bad.
of influencers. That's nice. Yeah.
Long way to go. But I think, see, for me, Mahesh, what I'm doing what I enjoy. I just want to spread the word, and I feel the position of the of I would say importance I hold in this, because there's no dearth of information in the fitness industry or in the
That's
fitness
that's
field.
right. That's right.
So that's right. So you'll have the trainers, you'll have the nutritionists, you'll have the influencers, you'll have a lot of people. You'll have all these models giving their own workouts. For me, it is two things. One is I've been on the dark side and I've come out of there, and I've experienced the kind of stigmas which were there with my physique and the kind of mental stresses I felt. And I've seen people in my gyms where I work out and people who are battling with those things. And I feel if at some point they can identify with me and I'm able to give them that little ray of hope, my job is done. And the second thing is that being an orthopedic surgeon and a medical person, I feel many times the same information, fortunately, unfortunately, coming through my mouth holds a little more value than your friendly neighborhood trainer telling you to start whey protein, or doing some kind of a new diet or something like that. So I think it's a very niche position I have, and I enjoy doing this. I've not stopped my orthopedic practice. So this is something which I think is attributed to the lockdown and the COVID which happened. And I hope to keep updating myself in my knowledge and spreading this kind of information to others. So I would request anybody who's interested can follow this for daily updates on what I'm doing and what I suggest in my workouts and my diet.
That's really nice. So if I have to just summarize today's conversation that we had on our self-care module, so we also have plans to do a mental health self-care module, and it is again as you rightly said, in doctors we deal with physical stresses, mental stresses, and all of that's combined. So we started off with a financial planning talk, and we're doing the physical health version today. And you've spoken about diet, you've spoken about exercise, you've spoken about how obesity is a problem. You've also spoken about the biochemistry of it, which I can was quite mind-boggling. Then you also showed us your workout routine, and you've taken most of the questions. And I guess if there are any questions, we can always have them. Of
True.
course, they have your
Yes,
page
yes.
and
There will
keep
be.
writing to us. Yeah,
There will be lots of questions. I think we have just kind of touched the tip of the iceberg. I think
sensitized
there's a
most of
lot
it.
of, I think so,
And
because I think just to summarize, yeah. So
go ahead.
my
Yeah.
just to summarize, so Mitro, the take home message for you is number one, if you go by my example and if you saw what I looked like once upon a time, it would not have been possible that this guy is having a fitness page for himself today. So anyone can get fit. You just have to follow the science. It's a science. So don't try to overthink it. There was a time when I used to overthink it a lot. I thought I was the medical guy. It's a science. You just have to follow the principles. Diet is the key. Diet is the key. I realized that a little later in life. I was also giving a lot of importance to exercise. Beware of the bad carbohydrates. All carbohydrates are not bad, but it's the sugars and the processed foods which you have to avoid. One simple take home message I would say, as far as carbohydrates are concerned, one of the rules which I use is if you can peel it or you can just boil it or cook it simply and eat it, that's a good carbohydrate. If you need to process it or you need to do some kind of a way to make it palatable, avoid it. So fruits are great, some oats, even rice, millets, these are good carbohydrates. Protein is crucial, like I've emphasized again and again. Strength training is the way to go. It doesn't mean going to the gym, but focus on getting yourself stronger, get your muscle mass up. For the women, get your osteoporosis under check, because you will all go to that path post menopause. Get that bone mass going, and you will prevent sarcopenia. You will have stronger joints and muscles, and you will prevent falls, and you won't have to come to an orthopedic surgeon like me ever in your life. And last but not the least, for those of you who are running marathons and doing a lot of cardio, yes, it's good, but avoid too much of it. It stresses the body, increases wear and tear. It's a repetitive strain, which we're not gone into today. So cardio is important, but that's more just as an endurance exercise. Focus more on strength and less on cardio.
Amazing, amazing. We've got some, again, as I said, in the background, we're getting a lot of great feedback, and I'm sure in the days to come, we will get this. And I remember you telling me once that, wafers are just boiled food. They're just boiled in oil.
Yes. Uh, it's a boiled food. Some people boil stuff in water, some people boil it in oil.
Oil.
Wafeluche.
Buffalo. So I think that that mindset that needs to change.
Yes, 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 yes,
It's not. So coming back to that, physically, if we as physicians, and we are caring for a huge group of patients, and if we are sensitized to this concept, I think it will make a lot of difference in the way we handle our patients and the health of the
I'm
community
certain.
in
I'm
general.
certain.
And especially with these coronavirus times and people are being so conscious about health. And I want to thank
Yes.
you, Doc, for taking time out and continuing to be an inspiration. And Kevin Kodros mentions that you're an inspiration and motivator. So,
Wow.
yes, yes.
Hi, Kevin.
And yes, and we have Rupal who's been quite interactive, and she spoke about calories in and calories out, and she said that how calories from an egg are different from calories from say sugar.
True.
So
True.
so we've had good questions, and thanks a lot for this topic. And although you did have the 70% diet and 30% workout, and one thing that I think stands out here is discipline. And I think that
True.
that kind of discipline and motivation, like kind of, I'm glad that there are people like you around, to help us out with this. And thanks for coming on our platform. And on behalf of
Thank you
all
so
my
much.
colleagues from the SIPP, and I want to thank Smart Paint Tech and all of them for helping us put up this show. Take care, Doc. If there's something we'll
Jack
need,
Doc.
Jack.
Cheers.
Yes. Thank you to all our
Bye, guys.
participants.
Bye.
It's been
Stay healthy.
100%. It's not one person who's logged out. It's been
Great.
100%. Yeah.
Excellent.
Bye. Bye.
Bye, Mahesh.
Take care,
Take care.
guys. Bye. Take care, guys. Bye. Thanks.
Bye.